Our next speakers are going to show us how this works in practice, and how it's leading to better lives. So we have Elizabeth Vosseller, the Executive Director of IASC and founder of Spelling to Communicate. She's worked with people with complex communication and sensory motor differences since 1995 in hospital, university, and private practice settings. In 2013, she began using assistive technology to teach students the purposeful motor skills to spell to communicate. After witnessing countless non-speaking, minimally and unreliably speaking individuals successfully communicating and learning through spelling and typing, Elizabeth founded IASC. It's a nonprofit organization committed to ensuring all non-speaking individuals have access to communication through training, education, advocacy, and research. She's going to be speaking with Ian Nordling, a non-speaking autistic self-advocate who spells on a letterboard or keyboard to communicate. Ian is passionate about inclusion, acceptance, and access to meaningful communication. He's taken part in coursework at the University of Virginia and George Washington University, and he seizes any opportunity to further his education and continue to feed his hunger for knowledge by taking courses at Growing Kids Therapy Center and online. He's a founding member of I&I Guys, a small business and self-advocacy group where he oversees production and serves as a community liaison, and he's worked alongside local law enforcement, first responders, and community officials to provide them with a pamphlet. Welcome.
Thank you so much. We're so happy to be here today and to talk a little bit more about spelling and the clinical implications for folks with sensory movement differences in autism. We're very happy to be here. I'm Elizabeth Vosseller, as Clarissa said, Executive Director of IASC, the International Association for Spelling as Communication. And this is my dear friend and colleague, Ian Nordling, and he does spell on letterboard. We're going to use a clear letterboard for good placement for him. Is not perfect viewing for you all, but you'll see the top of the board as he spells H-I-E-V-E-R-Y-O-N-E. Hi, everyone. I-A-M-H-A-P-P-Y-T-O-G-E-T-T-O. I'm happy to get to P-R-E-S-E-N-T, present, T-O-Y-O-U, to present to you, T-O-D, T-O-D. Okay, so K-F, that makes sense, A-Y. I'm happy to present to you today. So I'm calling out the letters so that you all are engaged and involved in the conversation. I don't have to. Ian can do this with me being silent, but then you're in the dark. I call that the letterboard equivalent of whispering. So we're doing that to include you all in the conversation. So thank you, Clarissa, for inviting us to present. Ian and I have 22 years of friendship. In fact, he's one of my longest running friendships, and certainly one of the longest running people that I've worked with. This is what Ian looked like when we started off, and we started the day after 9/11, which was, of course, a traumatic day for all of us who experienced it. And when I reached out to his mother to say, hey, are you up for getting together? She said, you know what? I think we have to, because I need to do something to feel normal. So that's how we came together, and we've been working together ever since. I asked Ian about the early days and how was it for him? And he said, I remember that Evie always had the kindest heart, which is generous. Thank you, Ian. She may have been wrong in her initial approaches, but she always wanted what was best. Traditional speech therapy was always a bit frustrating and inherently the wrong approach for me. Putting pictures to words reliably was impossible and definitely not all encompassing of what I could do. Play-based approaches are fine at 3 or 4, but there was no true expression in it. So I did traditional speech language therapy with Ian for about 8 years. His family moved away and we continued some long distance support. And when he was about 14, as I began spelling with my non-speaking clients, I reached out to his family and Ian came out for a visit. And that's when everything changed. Ian, is there something you would like to add to that? IWASNEVERE. I was never able. TOFULMICATE. I was never able to fully communicate. UNTIL until ISTAROT. Keep going. ED until I started SPELLING. I was never able to fully communicate until I started spelling. Now you'll notice from time to time that Ian will make a mistaken letter, and sometimes I wait to see what he does, or I'll call out that letter, and he corrects it. It kind of throws off his rhythm, just like if you were dancing and you sort of miss the next step, it throws you off for a few beats until you can get back into the rhythm. But it's the equivalent on the letterboard of a typo, right? This is accuracy of hitting the right letters, and every once in a while he hits the wrong letters, just like you and I would do when we're typing. Just so you're clear on that. So to back up a little bit, language is cognitive, right? It's in the left hemisphere of the brain. It's tapping into Wernicke's area as our area for comprehension. So as you're listening to me speak, the sounds are going out that I generate through my articulators out into the air, through your auditory system, which now is coming through your computer audio. It goes through your auditory system of outer ear, middle ear, inner ear, through the auditory nerve, and then connecting to Wernicke's area, where you're interpreting this as language. Connected by a bundle of fibers called the arcuate fasciculus. Wernicke's connects to Broca's area, which is our area for expressive language. So Wernicke's receptive, what you're understanding. Broca's your area for expressive language, which is your thoughts and ideas in the form of words, which is different than expressive speech, right? We often refer to speech as expressive, but speech is 100% motor. In order to communicate and share what we're thinking, we have to bring in the motor system, which is involving the sensory strip, the motor strip, right, which is the sensory and motor cortices, and the supplementary motor cortex, which is responsible for language on demand, for movement on demand. So these 3 areas work together to produce purposeful movement, and all communication requires purposeful movement, whether you're pointing, whether you're typing, texting, pulling someone, kicking someone, hitting, scratching, talking, using a keyboard, pointing to pictures on a device. Every single solitary way that we have of communicating requires motor. So speech is 100% motor. And here, just to show the layout of the primary motor cortex and sensory cortex, is the layout of that's often illustrated with the homunculus. And roughly 75% of the motor and sensory strip is dedicated to the motor and sensory of the digits and the articulators, right? And that's where we have our most robust communication, by using our digits or our articulators. So I can use my digits to type, to handwrite, to text with the magical thumbs. It works so much better in people under 30 than they do for those of us slightly north of 30. To point to pictures on a AAC device, right? And then our articulators we use to produce speech or sing or scream or anything like that. So Ian had asked him about the difference between speech and language, and here was his response. He said, definitely a subject that isn't understood as much as I would like. They are two completely different things. If it was understood that a lack of speech is not a sign of a lack of intelligence, then I would imagine everything would have been different. It was a shift to focusing on motor that changed my life. So Ian, what's one thing you think would have been different if people recognized that just because you couldn't speak, your language was intact? M, Y, E, N, T, I, R, E, E, D, U, C, A, T, I, O, N. My entire education, W, O, U, L, D, H, A, V, E would have G, O, G, O, N, E, I, N, gone in, A, D, I, F, F, E, R, E, N, T. My entire education would have gone in a different D, I, R, E, C, T, I, O, N. In a different direction.
Yeah.
How so? I, W, O, U, L, D, H, A, V, E. I would have L, E, A, R, N, E, D. I would have learned A, L, O, N, G, S, I, D, E. I would have learned alongside W, O, N, D, E, R, F, U, L, wonderful, S, P, E, A, K, get it? I, N, G, P, E, E, R, S. I would have learned alongside wonderful speaking peers. Yeah. So this has been an issue that because someone is non-speaking doesn't mean that they don't have intact language or that they don't have or that they have cognitive impairments. I'm not saying that it's not possible to have a language impairment or a cognitive impairment, but a lack of speech is not an indicator of a lack of intelligence. And certainly we like to say the corollary is not true, that just because someone is speaking that they are intelligent. Ian and some of his peers have suggested that just listening to any politician will prove that that is not true. So non-speaking is not the same as nonverbal. Nonverbal actually means from the Latin without words. And folks like Ian are not without words. In fact, his vocabulary choice is very specific. I like that he's in my wonderful speaking peers, right? He has language intact, he has words. So non-speaking is a better descriptor of people like Ian who, because of their motor sensory differences, aren't able to use speech as a primary and effective way to communicate. Non-speaking is an umbrella term that is inclusive of those who have limited speech, maybe no words or just a few words, minimal speech, which can be anywhere from a couple to a couple hundred words or phrases, often that are practiced and overlearned, and those who have unreliable speech. They talk all the time. They're singing, they're saying things. It could be things that they say over and over. It could be lines from a movie. It could be songs, but they're not able to use their speech communicatively to effectively talk about novel and new things in their life. So we want to talk a little bit about praxis. For many of you all, I know this is a clinical community, may be familiar with this, but I also know there's families and caregivers. So praxis is the process of going from idea to plan to execution to adaptation. So I might think to myself, I want a sip of coffee. That's my idea. Plan is to reach out my arm and get my coffee. So now I have to execute that. I have to do the action, but because my eyes are on the screen, I'm not looking at my coffee cup and I miss the coffee, right? I'm feeling air. So I can correct in one of two ways. I can look over at it and have now the sensory of sight guide me to my coffee cup, or I can feel around until I find the coffee cup, put my hand on it, and I can now bring it to my face and take a sip, right? One of the things that we do agree upon in the autism community, and there's not a lot that we're aligned on, is that in autism, sensory is generally off. It can be too much or too little and can vary from stimulus to stimulus and person to person and time to time. My friend Ian does not enjoy the sounds of babies crying or dogs barking, right? But yet he can have other sounds going quite loudly, and those don't bother him. So as such, the sensory system is not a great navigator for the motor system in our autistic community and for those who have other motor sensory disabilities. In Spelling to Communicate, about 70% of our population worldwide is autistic. 30% have other motor sensory disabilities, often genetic syndromes or conditions like Pitt-Hopkins, Phelan-McDermott, Down syndrome, Prader-Willi. There's a number of disabilities that present with motor sensory differences. When you have an issue with praxis, you have apraxia or dyspraxia. People disagree about which to call it. We tend to say apraxia because it's most often used with speech, but our community has full body apraxia issues for the most part. I love Ian's definition. For those of you who don't know what praxis is, it's the way you get your body to do everything you want it to do. Literally, even the smallest purposeful movement. Now, imagine that you know what you want your body to do, but you can't get it to do it. That is apraxia. There is a disconnect between the brain and the body. It's like having your hand tied behind your back and duct taped over your mouth. You still have conscious thought, but cannot communicate. That is our lived experience, our brain-body disconnect. So Ian, besides speech, can you tell us another way that apraxia affects you? H-O-W-I-S-I-T N-O-T. How is it not B-I-N-O-B-S-T-A-C-L-E-F-O-R-M-E? How is it not being an obstacle for me? I-N-E-V E R Y M O M E N T in every moment. O F M Y L I F E. How's it not being an obstacle for me in every moment of my life? Now, I want you to know that I've been resting my hand on my leg, and then I think to myself, well, I don't want you guys to think I'm up to something, you know, where I'm signaling to Ian or touching him in any way. So now I'm doing what probably looks weird of just kind of resting my hand on my shoulder, which is not a natural position, but I want you to see there's no tricks up my sleeves, literally. Of course, I can't see your face, and so I don't know if you're getting all my great jokes here. Okay, so Ian also adds, apraxia is constantly a battle for me. I know what I want to do and I know how to do it. However, getting my body to go along with my brain is telling it to do is greatly challenging. If I'm coached to do something and have opportunities to practice, then it becomes easier. But if it's something new, it's a struggle. Help to support my motor breakdown of new tasks is how I'm able to learn to do new things and is crucial to my success. So Ian, what's something that you've been taught and coached from a motor perspective how to do that you wouldn't have been able to do just from your brain telling your body to do it? I L E A R N E D H O W. I learned how. T O P L A Y C H E S S. I learned how to play chess. So we actually, for that, created a letterboard that had the proper notation to use the chess algebraic notation to spell out his moves, and then worked on motor coaching for his body to move the chess pieces accordingly. And actually, Ian is quite good. Ian, do you have any comments to it? A N Y O N E, anyone, W A N T T O T R Y M E O U T. Question mark. Anyone want to try me out? If I'm not a betting person, but if I were, I'd put my money on Ian. Okay, so just a quick bit about motor. 4 kinds of motor that we're concerned about. Reflexive, impulsive, purposeful, and automatic. Reflexive motor is triggered at the level of the brainstem and the spinal cord. It's unplanned, and there's no cognitive neurons in those areas. Impulsive motor is triggered at the level of the amygdala and the limbic brain, right? The amygdala, it's triggered by fear and anxiety. The limbic brain often triggered for desire or other emotions, right? So some kids see me with my glasses that when I need them are handily perched on my head, and they'll reach up and grab them right away because I don't know why. They don't think it belongs on my head, or they want to see them, right? Without thinking about the fact that this is my personal space. And or we've been with some of our friends in a restaurant, and as they're walking by, they might snatch a French fry off somebody else's plate, right? They'll spell on the board, oops, I knew that was not my fry to grab, but I couldn't stop my impulsive body. There's no thinking neurons in these areas, and these pathways for reflexive and impulsive actions are very, very fast. They go out quickly to the body, and they're well myelinated. I just want to point out that often it's these reflexive and impulsive actions that get labeled as behavior, when really a behavior is a purposeful action, right? Computer programmers define a behavior as a user action, right? It's really just an action. Behavior has become in the disability world kind of synonymous with bad or undesirable. But in reality, these actions cannot be controlled. So the same kid who might walk into a session with me, or if you're a physician into your doctor's office, they see you in your white coat, you walk in, you close the door, that might trigger anxiety, which will get that kid to, reach out and maybe grab you or hit you or pinch you, or might trigger fight or flight. But that same person, once you've established a relationship and once they're well regulated, if you say, hey, reach out and smack me, which you may not want to give that invitation, but would probably have a hard time doing that because now that motor action would be purposeful, right? Purposeful action requires that harmony between the motor cortex, sensory cortex, and supplementary motor cortex working on demand. All novel movement is purposeful. All of us, for every motor skill that we have, it was at one point new and novel, right? Including how to walk, how to handwrite, how to drive a car. But as we have practiced those actions over and over and over again, they switch to automatic. Automatic actions bypass cognitive because they become well myelinated habits. Right? So things that we do over and over and over again move into automatic. Ian, thoughts about this? I, T, I, S, H, A, R, D, F, O, R, M, E. It is hard for me. T, O, L, E, A, R, N, N, E, W, to learn new, M, O, V, E, M, E, N, T, S. It is hard for me to learn new movements. I, D, O, N, T, L, I, S, T, E, N, A, N, D. I don't listen. And O, B, S, E, R, V, E, T, H, E. I don't listen and observe. The, or T-H-E, S, A, M, E, W, A, Y, T, H, A, T, N, T, P, E, O, P, L, E, D, O. I don't listen and observe the same way NT people do. I, N, E, E, D. I need D, I, R, E, C, T. I need direct C, O, A, C, H, I, N, G. I need direct coaching. So Ian's comments about reflexive and impulsive motor don't equal behavior. He said, I remember it well as much as I wish I could forget it. It is unfortunately something that I still battle on occasion. Evie is correct that it is not malice-led or deliberate, right? We're talking about the impulsive and reflexive movements. Eventually, I learned the term impulsive motor, and this is a perfect example. It is something that happens when I become dysregulated, and sometimes as hard as I try, I cannot stop it from happening. Now, Ian has given me permission to talk about this. When Ian was little, he was a biter, and in fact, I was bitten many times by Ian, and as Ian said, I wish I could forget it, but this was impulsive and not something he could help. I, F, E, E, L, sorry, F, E, E, T, L, T. Okay. can we start that word over? Because I don't want to misinterpret it. I-F-E-L-T. Okay, I felt. T-E-R-R-I-B-L-E. I felt terrible. B-U-T-I-C-O-U-L-D, but I could N-O-T-C-O-N-T-R-O-L, but I could not control M-Y-B-O-D-Y. I felt terrible, but I could not control my body. So what is spelling to communicate? In spelling to communicate, skilled and rigorously trained communication partners and practitioners teach the purposeful motor to accurately point to letters on a letterboard in order to spell. We break it down from simple to hard by starting initially with, oh, I don't have my set of 3 boards here, with the alphabet split in thirds. Then we move to the full alphabet by splitting the alphabet into smaller bits. There's a smaller visual field to scan, and the letters are bigger. Once somebody gets good at that, we move to 26 letters. Once somebody gets good at that, we move to a laminate board, usually not a clear board at first, usually a board more like this or like this that is clear, is not clear, right? Has a solid background. We like to use the clear board for presentation so you can see what Ian is poking. As skills progress and as somebody becomes more accurate, we can move from known responses, right? When I'm first teaching somebody, I need to know what the target is, right? So if I'm teaching about New York and I say, what are we learning about? New York is the only possible answer, and I know which boards to hold. As somebody as open-ended as Ian, I don't know what he's going to spell. I'm simply receiving the letters. In the same way that as you're listening to me, you're simply receiving my speech sounds and you understand what I'm saying. I could say something absolutely ridiculous like rainbow clouds, rain, unicorn, marshmallows. And as weird as that is, you understood my words. So as Ian is able to clearly point to letters, he's able to say the words or to spell out the words he wants to say. Ian says communication changes everything. And our friend, Dr. Vikram Jaswal, just gave the previous presentation. This goes way back to when I first invited Vikram to come and speak to our a group of our non-speakers. And that's what led to some research because they said, hey, Vikram, we want to get involved in this. Ian says, communication has been the greatest change of my life to have started to spell to communicate. It's changed my life in ways that I could never have imagined. I'm able to choose my own clothes, decide what I want to eat, introduce myself to new people I meet, tell my family how I'm feeling, telling them I'm having a hard time at my groups, tell them I need a change of scenery, tell them I'm having too many sensory experiences and I need to leave a location, right? So that agency and autonomy does change everything. Ian and I put together some advice for physicians and clinicians who are working with non-speaking people. We also got this advice from our Spellers and Allies, which is the advocacy branch of IAS. Great. And you are doing great. And Spellers and Allies are non-speakers who are fluent spellers over the age of 18 with their speaking peers who may or may not, who may be neurotypical and neurodiverse. And they collaborate together. This is not a buddy program, it's bi-directional mentoring. And so they put this together to be aware, to have awareness and understanding of what the sensory needs might be for non-speaking people. So limit noise, bright lights, extra stimulation, create a comfortable space using soft lighting and minimal background noise, which is not the condition of most hospitals and sometimes not of many doctors' offices. Helping to create a calm and quiet environment. Recognizing that each person has their own needs and their own things that disturb them, and that non-speaking does not necessarily mean non-communicative. And they really urge you to please be aware of other methods of communication. So if you have somebody who comes in to work with you, whatever your setting is, and is not communicating reliably by mouth, ask if they use a form of AAC and respect their method of choice. They said that patience and reassurance is helpful. Approaching non-speakers slowly and calmly, offering reassurance. I urge you to remove white coats where possible. There's a lot of bad associations with that, and you could trigger some reflexive and impulsive actions. And giving ample time to process information and respond. Respecting individuals' choice of communication, where possible, gaining informed consent. Communicate with the non-speaker, not the communication partner, as we call it a CRP, a communication regulation partner, and ensure access to preferred AAC in all settings. If there is a support person involvement, whether that's a parent, a CRP, an aide, someone who's close to them, first respecting the non-speaker, but then the input from the trusted caregiver who may be able to give extra insight. And that knowing that some individuals are hypersensitive to touch, right? Something that you may see as non-invasive may feel very invasive or is a significant sensory experience to an autistic non-speaking individual or a non-speaker with other motor sensory disabilities, and trying to use the least invasive method of examination and treatment as possible. For some of my guys, they love to get really close. Ian is a hand holder, right? Frequently, if he's beside me, he holds my hand, and that's regulating for him. For other people, if I attempted to hold their hand or I initiated that may not be well received. So, really thinking about what that individual's needs are and trying to read that and vary your approach. Minimizing transitions and changes, that non-speakers may struggle with changes in routine and environment. Limiting those transitions and communicating changes in advance. So if there's a change of shift, if there's a change of staff, communicating that, knowing that they're listening and understanding, and being a part of that, even if it's an individual who can't give you that response yet because they don't have an effective means of communication. These things will go a long way to having a much more successful visit. Documentation and education is so important. We have many non-speakers like my friend Gregory who have been able to communicate openly and successfully in doctor's visits. So having that communication preference documented, so if there's another physician or therapist or clinician or support person who comes into the scene, that they know what the speaker's preferences or the non-speaker's preferences, and making sure to share this. This has been huge for so many of our non-speaking individuals that even before they showed signs clinically of something going on, that they were able to communicate it. I've been given permission to share that one of our non-speaking folks who started spelling when he was 49, when he was in his early 50s, he had become fluent with his brother. They were in the middle of a conversation and he said, "Stop, I'm in need of medical attention." He spelled this on the board. He spelled out his symptoms, which led the family to pursue a doctor's appointment. And because he could describe symptoms, it led to a diagnosis of testicular cancer, which nobody would have known about or been able to observe. He was able to have surgical intervention that resolved the issue. He did not need to go through chemotherapy or other treatment. And so in this case, his ability to communicate was not just life-changing, it was life-saving. And we have many similar stories of people sharing ear infections, strep throat, things like that coming on well before somebody could see it clinically.
Thank you.
Ian, am I running out of time, Clarissa?
Yeah, there's some questions, so I want to make sure that we have some time for it. Do you have
I'm
last
just
slide?
about wrapped, and
Okay.
I'd be happy to take the questions.
Okay.
So Ian has now become quite an advocate. He and I have done several talks to the local fire and rescue. Ian was part of the town of Herndon, where we live, youth advisory. And we have now trained about 6 battalions of firefighters and first responders in how to approach non-speaking people, as well as people with general motor sensory issues. And again, they've come back and reported, this has really worked for us, and we're really grateful for this training. And then finally, we've been able to participate in research. So this was Ian and I in 2017, participating in Dr. Jaswal's eye tracking study. So here he's wearing the eye tracking glasses. At one point, we tried to see what kind of data we would get if I was wearing the eye tracking glasses, but because the board is held such that it's in Ian's, visual field, it's centered around the dominant hand, so that it's an easy slight head turn to look at the board and looking at it in a vertical plane versus horizontal, which is much more difficult to track. But because I was from the side and I'd had to use more of my peripheral vision to look at the board, that didn't track so well with us. But it was a great opportunity to participate in research. And we continue to innovate and look at new ways to advance technology. We're looking at the creation of a digital smart board that's still very, very much in its beta and pilot phases. But again, with the informed communication of those who it's their lived experience and their needs and preferences, it's really been a game changer. Here's further research. This is one of our non-speakers and I went to Scotland, where we're working with a motor researcher there, and she's wearing sensors and quite proud of herself wearing all these sensors. So it looks at her movement as in real time as she's moving. So there's just very exciting things coming down the pack.
It really is exciting. Yeah.
I'm going to leave this up so it's got all the contact information there. And Clarissa, Ian, and I are happy to answer questions.
So one question for you, Ian, is how did you learn to read?
Yes.
N-O-O-N-E-T-H. You want to cross it out? So he hit the backspace. T-A-U-G-H-T-M-E-T-O-R-E-A-D. No one taught me to read. I-T-A-U-G-H-T-M-Y-S-E-L. Go to it, F. I taught myself. E-V, that's me. T-H-I-N-K-S. Evie thinks. I-A-M-A-G-E-N-I. Get it? U-S. Evie thinks I'm a genius. B-U-T-I-O-N-L-Y, but I only H-A-V-E, only have S-T-R-O-N-G, strong, P-A-T-T-E-R, pattern, R-E-C-O-G-N, I-T-I-O-N. But I only have strong pattern recognition. So all around the world with different people who use different methods of spelling and typing to communicate say the same thing. I taught myself to read because reading is pattern recognition and letters are consistent, right? Print is everywhere. And seeing that print everywhere from the time when they were little, where same age peers are exploring the world through motor, they are not able to do that. And print and letters became friends and is how they learned how to read, which you can't spell without reading.
We have time for one more brief question because we're running a little over, but there's a lot of interest in how do you get started with this? Are there providers? Is this the same thing as other therapies that address motor skills like language acquisition through motor planning or RPM or facilitated communication? How do you get started, or how do you access these techniques?
So I'll try to wrap that in one big answer. So one, if you're interested in spelling to communicate, which is the method that I started, you can contact IASC, reach out to info@i-asc.org. Don't forget the dash or you end up with avocado growers and you'll learn about guacamole, but not spelling. We have practitioners all over the world. We can connect you to a practitioner that's near you. And if there's no one near you, we have some who can give virtual support. So that's one thing. It is not the same as FC or RPM or Speller's method, which are other methods that use the alphabet, spelling and or typing to communicate. And by the way, Ian can type, but then you wouldn't be able to see it. He uses a regular Apple Bluetooth keyboard. Somebody asked before, why not use a QWERTY letterboard? You were not taught to read and spell in QWERTY. QWERTY was designed for the motor of the 10 fingers to type, such that the strongest fingers hit the most common letters. You learn the ABCs in reading and spelling. So that's why we start with ABC. When we switch over to keyboard, the motor's so strong, it's seamless. Each methodology is good and has their merits. There's just different protocols and things to do. I think the key is that you find a methodology that's available to you and that works for you. So I think that is kind of answers your question from a global perspective, right? You can reach me at elizabeth@i-asc.org. And I think if my screen is still on, you can see our email, our Instagram, our Facebook, and our LinkedIn. We have a very robust website, i-asc.org. We've got videos, we've got articles, we've got a section on research. We do monthly free webinars. We aim to make as many of our resources free as possible. The only things that are paid are our annual conference in July and our practitioner training. Everything else we have made available for free. Our CRP training for parents also has a fee, because those are people who are spending loads of man hours to do those. But tons and tons of free resources, a free webinar every month, and we're happy to answer your questions by email or connect you to practitioners.
Thank you so much. This was amazing. There's a lot of questions in the Q&A, so if you have time to head over there
and answer those, I'm very happy
wonderful.
to do that. And then
Thank
can I
you.
give you the last word, Clarissa?
Sure.
Okay. THANYOUFORLISTENING. Thank you for listening. IHOPEYOU. I hope you LEARNED. I hope you learned something. Sorry, I hope you learned ST Sorry, Ian, I threw you off. I hope you learned N-E-W, you're gonna prove that I was not there, new, I-N-G-F-O, okay, R-M-A-T-I-O, and I hope you learn new information, A-N-D-I-F-Y-O-U-A-R-E-A-P-A-R-E-N-T, and if you are a parent, D-O-N-T-G-I-V-E, get it? U-P. And if you are a parent, don't give up.
Don't take you.